Hi, I'm Dr. Paul Ruff at West End Plastic Surgery. We're moving into the fall, which means in DC, cooler weather, crisper days, less ambient light. I'm personally not a fan. I actually kind of like it hot. But I think most people enjoy this. Most people enjoy being able to be outside, not sweating all the time. But it does mean change. And in our practice, we like to use that as a point of reference to start talking to people about fall and winter skincare, which does change. You know, we don't have as much ambient light about. We don't have as much humidity in the air. And so our skin starts to feel drier. We get a little bit more wind. And you know, the effect that has on the surface of the skin. I am a big fan of creating and maintaining a very strong bond with an esthetician. And we have three amazing estheticians here. We have Renee and Bonnie and Kelly, and they are just fantastic at what they do. And so I really encourage patients start to develop a routine with them, even if it's just once every 3 to 4 months. That allows you to adjust your skincare as the ambient temperature or maybe your vacationing needs mandate or dictate. Our skin is probably one of the things that we look at and criticize and critique the most ourselves, and making small changes on a regular basis actually is more cost efficient, more cost effective, but will help maintain your skin looking as young and youthful and toned and clear as it possibly can be. So what do we do in the fall? One of the things I like is IPL. Intense pulse light. It's probably good for almost anybody. It treats a wide variety of issues. It is a minimal downtime procedure, which is great. When I've had mine, I just feel like my skin doesn't look its best for a few days until it turns itself over, and then all of a sudden some of the browns and the reds are gone, and you get a little bit more tone. One of the things I really love about it, it is cumulative over time. There's a dermatologist, Dr. Patrick Bitter, who did early look at what cumulative treatments with IPL ended up leading to. And he found that it biologically improved the skin in a meaningful way. So even if you did it once or twice a year, that cumulative effect would be valuable over time. So IPL is one of the most amazing ones, I think. I call it erasing the sins of the summer. Most patients will do a treatment, at least their first series, once every 4 to 6 months, and then they will move to twice a year. Some people will continue to do it every 3 months, kind of whatever fits with your budget and your expectations. On top of that, there is also something called Cool Peel, and it's a particular CO2 laser, but it is tuned to a very superficial depth. Once again, minimal to no downtime, but essentially takes off some of the very surface layer, what I call the barnacles on the skin. Helps out with tone and texture, can work in conjunction with IPL in many cases. I wouldn't necessarily do them in the same day, but they can be interspersed so that you're continuing to stimulate and turn over that skin on a regular basis. And then one of our new favorites is microneedling with radio frequency. This uses tiny little microneedling arrays that go down to a pre-described depth underneath the skin, deliver energy to create a remodeling process. And how that energy is delivered and the density with which it is delivered is really what either dictates the downtime or the overall result. And with any of these, one treatment will have an effect, but they're typically done as a series and then into a maintenance phase that may be once or twice a year. If you couple that with really good but not necessarily expensive skincare, you can expect to have much better skin quality for yourself and your age-matched peers. Sometimes even your less than age-matched peers, which is what I strive for. So I hope that helps. Like I said, we're moving into the fall season. It's a good time to think about what you want to do to help continue to take care of your skin and maybe erase some of the sins of the summer. We look forward to having you here. As always, don't hesitate to reach out, www.westendplasticsurgery.com, or call us at 202-785-4187.